Last month, something happened that should terrify every American over the age of 50. United Healthcare, the largest health insurer in the United States, announced it would withdraw from Medicare Advantage markets in 109 counties across 16 states starting January 2026. This single decision displaced 180,000 seniors from their health coverage. But here is what the headlines did not tell you. Those 180,000 people are now trapped. Many cannot go back to traditional Medicare without paying thousands of dollars more in premiums. Some will be denied coverage entirely because of pre-existing conditions they developed while in their Medicare Advantage plan. And this is just one company. Aetna is closing approximately 90 Medicare Advantage plans across 34 states. Humana is pulling out of markets that are not profitable. 15 major health systems are dropping Medicare Advantage plans entirely for 2026, including Mayo Clinic and Mass General Brigham. What is happening right now is unprecedented, and it reveals a much deeper crisis that affects not just healthcare, but the entire financial foundation of retirement in America. Today, we are going to talk about a trap. Actually, we are going to talk about several interconnected traps that have ensnared millions of American seniors. These are not accidents. These are not random misfortunes. These are the predictable results of policy decisions, corporate behavior, and a retirement system that has fundamentally failed ordinary people. I am going to show you exactly how each trap works. I will explain the mechanisms, give you the data, and most importantly, tell you exactly what you can do to protect yourself. Later in this video, I will reveal the single most powerful strategy most people overlook when planning for retirement. It is something that can add decades of security to your financial life, but almost nobody talks about it. By the end of this video, you will understand exactly how these traps work. More importantly, you will know the specific steps you can take to protect yourself or your parents from falling into them. I will give you clear, actionable advice that you can start using today. Let us begin with the numbers, because the scale of this crisis is staggering. According to the National Council on Aging, 80% of households with adults aged 60 and older are either currently financially struggling or at serious risk of falling into economic insecurity as they age. That is not a typo. 80%. We are talking about approximately 47 million households. Let me say that differently. Only 2 out of every 10 older American households have enough resources to handle a major financial shock like serious illness, long-term care needs, or even the death of a spouse. Nearly 50% of older adults have incomes below what they need for basic necessities like housing, food, transportation, and healthcare. We are not talking about luxury. We are talking about survival. And the situation is getting worse, not better. A 2025 retirement survey found that 22% of adults age 60 and over are still working. 18% say they will never retire. Never. Close to half, 46%, are thinking about returning to the workforce after retirement because they cannot make ends meet. When asked why, the answer is simple. They cannot afford not to work. Now, I want you to hold those numbers in your mind as we dive into the specific traps, because understanding how they work together is the key to escaping them. Trap number 1, the Medicare Advantage lock-in. Let us start with healthcare, because it is often the first domino to fall. Medicare Advantage, also called Part C, has become incredibly popular. In 2025, more than half of all Medicare beneficiaries, about 34 million seniors, were enrolled in Medicare Advantage plans. Why? The marketing is brilliant. These private insurance plans often have zero or very low premiums. They offer extra benefits that traditional Medicare does not cover, things like dental, vision, hearing aids, and sometimes even gym memberships. Sounds great, right? Here is what the advertisements do not tell you. When you sign up for Medicare Advantage, you are making a decision that could haunt you for the rest of your life. Because in 46 out of 50 states, once you leave Medicare Advantage and try to go back to traditional Medicare, you may not be able to get affordable supplemental insurance. Let me explain how this works. This is important, so pay close attention. Traditional Medicare, the government program, covers about 80% of your medical costs. The remaining 20% comes out of your pocket. There's no cap on this. If you have a $500,000 hospital stay, you could owe $100,000. If you need cancer treatment that costs $300,000, your share is $60,000. This is called coinsurance, and it has no upper limit in traditional Medicare. To protect against this, people on traditional Medicare buy Medigap policies. These are supplemental insurance plans that cover that 20%. They also provide an out-of-pocket maximum, which Medicare Advantage plans include by design, but traditional Medicare does not. But here is the trap. And this is where many people discover they have made an irreversible mistake. When you first enroll in Medicare at age 65, you have a guaranteed right to buy Medigap coverage. Insurance companies cannot deny you or charge you more based on your health. This is called your Medigap open enrollment period, and it lasts 6 months. After that window closes, insurance companies in most states can do what is called medical underwriting. They can look at your health conditions and either deny you coverage entirely or charge you significantly higher premiums. So what happens when you are in Medicare Advantage for 5 years, develop diabetes and heart disease, and then your plan gets discontinued or your doctor leaves the network? You try to switch back to traditional Medicare. But now you need Medigap coverage to protect against that unlimited 20% exposure. And because you have pre-existing conditions, insurance companies can deny you or price you out of the market. A 2024 Johns Hopkins study found that high-need beneficiaries in Medicare Advantage often want to switch back to traditional Medicare, but face enormous barriers because of these supplemental insurance restrictions. Only 4 states, New York, Connecticut, Maine, and Massachusetts, prohibit this practice and allow you to switch back with guaranteed Medigap coverage regardless of your health. If you live anywhere else, you are essentially locked in. This is the Medicare Advantage trap. You sign up when you are healthy because the benefits look good. Then, as you age and get sicker, you discover that your plan has narrow networks, requires prior authorization for treatments your doctor recommends, and sometimes denies necessary care. But you cannot leave because leaving would expose you to catastrophic out-of-pocket costs. Critics estimate that Medicare Advantage plans overbill the government by up to $140 billion annually through a practice called upcoding, where they exaggerate how sick their patients are to receive higher payments. Meanwhile, they use AI-driven systems to deny claims and restrict access to care. Now, I promised I would give you actionable advice, so let me do that right now for this first trap. Action step 1. If you are approaching 65 and have not yet enrolled in Medicare, think very carefully before choosing Medicare Advantage. If you have any chronic conditions or family history of serious illness, traditional Medicare with Medigap coverage may be the safer long-term choice, even if it costs more upfront. Action. Step 2. If you are already in Medicare Advantage and relatively healthy, consider switching to traditional Medicare and buying Medigap coverage now while you can still pass medical underwriting. Do not wait until you are sick. Action step 3. If you live in one of the 4 states with guaranteed Medigap access, New York, Connecticut, Maine, Massachusetts, you have more flexibility. Take advantage of it. Action step 4. If you are stuck in Medicare, Advantage with health conditions, become an expert on your plan's appeals process. Nearly half of Medicare Advantage directories contain inaccurate provider information, and many denials can be overturned on appeal. Do not accept the first no. Trap number 2, the retirement savings cliff. I want you to remember something I said earlier. I told you I would explain how stress works in this system. Keep that in mind as we go through this next trap, because understanding the biological mechanism behind financial stress will help you see why these problems compound so rapidly. Now let us talk about the financial foundation that is supposed to support everything else. The median retirement savings for Americans aged 55 to 64 is approximately $185,000. For those 65 to 74, it is about $200,000. That might sound like a lot of money, but let me put it in perspective. Using the traditional 4% withdrawal rule, $200,000 generates $8,000 per year. That is $667 per month. The average Social Security benefit in 2026 will be approximately $2,071 per month. So combining both sources, a typical retiree has about $2,138 per month to live on. Now let us look at costs. The national median cost for a semi-private nursing home room in 2026 is projected at $9,840 per month. A private room is $11,294 per month. Assisted living averages $5,900 per month. Even home health aid services cost over $6,000 per month. Someone turning 65 today has almost a 70% chance of needing some type of long-term care services and supports in their lifetime. And Medicare does not cover long-term care. Do you see the math problem? Average monthly income of $2,738. Average long-term care cost of $6,000 to $11,000 per month, and a 70% chance you will need that care. This is not a trap that catches a few unlucky people. This is a system designed to fail. But here is where it gets even more insidious. According to the Economic Policy Institute, disparities in financial fragility are enormous. 57% of older Black households and 50.7% of Hispanic households are financially fragile, meaning they have high debt, high housing costs, and low emergency savings. Compare this to 33.4% of white households. These same communities are more likely to work in physically demanding jobs, which means higher injury rates and greater difficulty continuing to work into old age. The system pushes them into a corner. They cannot save enough to retire comfortably. They cannot work longer because their bodies break down. And they are first in line for the kind of catastrophic health events that wipe out whatever small savings they do have. About 37.9% of seniors never saved specifically for retirement at all. The median senior began building their retirement savings in their 50s. By then, compound interest has far less time to work. Why did they not save earlier? Because life got in the way. Student loans, housing costs, raising children, helping elderly parents, medical emergencies, wage stagnation while the cost of everything else kept rising. The retirement savings crisis is not about personal irresponsibility. It is about an economy that has transferred all the risk from employers and government onto individual workers, while simultaneously making it harder and harder to build wealth through wages alone. Action Step 5. Calculate your actual retirement number. Not the vague save as much as you can advice. I mean, sit down and figure out what your monthly expenses will be in retirement, multiply by 12, multiply by 30 years, and factor in inflation at about 3% per year and healthcare inflation at 6%. Then look at what you actually have saved. The gap is your problem to solve. Action Step 6. If you are behind, the single most powerful thing you can do is delay retirement if possible. Every year you work is a year you are not drawing down savings, and a year you are potentially adding to them. It is not fair, but it is math. Action. Step 7. If you are over 50, you are eligible for catch-up contributions. In 2026, you can contribute an extra $8,000 to your 401k beyond the standard limit. For IRAs, the catch-up is $1,100. Use these provisions aggressively. Action Step 8. Look into health savings accounts if you have access to a high-deductible health plan. HSAs are triple tax-advantaged. Money goes in pre-tax, grows tax-free, and comes out tax-free for medical expenses. After 65, you can withdraw for any purpose without penalty, though non-medical withdrawals are taxed as income. This is one of the most powerful retirement tools available. Trap number 3, the Social Security squeeze. Let us talk about Social Security, because for millions of seniors, it is not a supplement. It is everything. For retirees with household incomes below $50,000, Social Security is the primary source of income. 77% of seniors rely on Social Security to afford their retirement lifestyle. For 19%, it is their only retirement plan, and Social Security is in trouble. According to the Committee for a Responsible Federal Budget, benefits could be reduced by 24% as early as late 2032. That is not some far-off projection. That is 7 years from now. For a dual-income couple retiring at the start of 2033, a 24% cut would mean roughly $1,840 less per year. 61% of current Social Security recipients say that missing even half of a payment would leave them unable to survive financially. Now, I want to be clear, Social Security has faced funding challenges before, and Congress has always acted to preserve it. The political consequences of cutting benefits for 70 million voters are severe, but the longer lawmakers wait, the harder the fixes become. The trap here is timing. Many people claim Social Security benefits as soon as they are eligible at age 62. 33% of beneficiaries claim at the earliest possible age, locking in permanently reduced benefits. If you claim at 62 instead of your full retirement age, currently between 66 and 67 depending on your birth year, your benefits are reduced by up to 30% for life. If you delay until age 70, your benefits increase by about 8% per year beyond full retirement age. That is a guaranteed return no investment can match. Let me make this concrete. Say your full retirement benefit at 67 is $2,000 per month. If you claim at 62, you get about $1,400 per month. If you wait until 70, you get about $2,480 per month. Over a 20-year retirement, that difference is $259,200 in total benefits. But here is the trap. People who most need the money often claim early because they have no choice. They do not have savings to bridge the gap between leaving work and optimal claiming age. So they lock in lower benefits precisely because they are already financially vulnerable. This creates a vicious cycle. Low lifetime earnings lead to low savings. Low savings force early claiming. Early claiming reduces lifetime benefits. Reduced benefits lead to poverty in old age. Action. Step 9. Unless you have a serious health condition that significantly reduces your life expectancy, try to delay Social Security as long as possible, ideally to 70. Every year you delay after full retirement, age adds 8% to your lifetime benefit. Do not set your retirement plan once and forget it. Review it annually. Make adjustments as circumstances change. Stay flexible. Let me be direct with you for a moment. The retirement system in America is broken. It was designed in an era when people died younger, when companies provided pensions, and when Social Security was fully funded. None of those things are true anymore. Today, people live longer, which means they need more money. Pensions have been replaced by 401ks, which shift all the risk onto individuals, and Social Security is heading toward insolvency. The government is not going to save you. Your employer is not going to save you. You have to save yourself. That means taking control of your financial future. It means understanding the risks. It means making a plan and sticking to it. The numbers I have shared today are alarming, but they are not hopeless. Millions of Americans have saved enough. Millions more can still take action to improve their situation. Most people think index funds are diversified. They see 500 stocks and assume that means protection against any single company's failure. But that is not how market cap weighted indexes work. In a market cap weighted index like the S&P 500, companies are weighted by their total market value. The bigger the company, the bigger its share of the index. Right now, the top 10 companies in the S&P 500 account for about 40% of the entire index. The Magnificent Seven alone make up about 35%. That means if you own an S&P 500 index fund, more than a third of your money is in just 7 stocks. And those 7 stocks are all in the technology sector, all making massive bets on artificial intelligence. This is not diversification. This is concentration hiding behind the label of diversification. If you want true diversification, you need to look beyond standard market cap weighted funds. Equal weighted S&P 500 ETFs give each company the same weight, reducing concentration in megacaps. International funds give you exposure to companies outside the US. Small cap and mid cap funds give you exposure to different segments of the market. The goal is to own assets that respond differently to different conditions. When US tech stocks fall, maybe international stocks hold steady. When stocks fall, maybe bonds rise. When inflation spikes, maybe gold and tips protect you. This is how you build resilience into your portfolio. One more thing I want to discuss is healthcare costs, because this is the wild card that destroys more retirement plans than anything else. The average 65-year-old couple will spend approximately $315,000 on healthcare in retirement, not including long-term care. That number includes Medicare premiums, supplemental insurance, copays, deductibles, and out-of-pocket costs. If you need long-term care, add another $100,000 to $500,000 or more, depending on how long you need it and what type of care you require. These costs are rising faster than general inflation, and they are largely unpredictable. You cannot know in advance whether you will be healthy or sick, whether you will need a nursing home for 6 months or 6 years. This uncertainty is what makes retirement planning so difficult. You cannot simply calculate your expenses and multiply by years of retirement. You have to plan for contingencies. Some strategies to consider. First, maximize your health savings account if you are still working and have access to one. HSA contributions are tax-deductible, growth is tax-free, and withdrawals for qualified medical expenses are tax-free. After age 65, you can use HSA funds for any purpose without penalty, though non-medical withdrawals are taxable as income. Second, understand your Medicare options thoroughly. Original Medicare, Medicare Advantage, Medigap plans, and Part D drug plans all have different costs and coverage. The wrong choice can cost you thousands of dollars per year. Third, consider long-term care insurance, but do it while you are still healthy enough to qualify and young enough to afford the premiums. A policy purchased at 55 is far cheaper than one purchased at 65. Fourth, have a family conversation about long-term care preferences and expectations. Will family members provide care? What happens if no one is available? What is the plan? These are not comfortable conversations, but having them now is better than facing a crisis later without a plan. The retirement crisis I have described today is real, but it is not inevitable for you personally. The people who will be broke after the next market move are the people who have not prepared. They are the ones with all their money in one basket, no cash buffer, no plan for a downturn, and unrealistic expectations about Social Security. You do not have to be one of them. The tools exist, the knowledge exists, the path exists. What is required is action, decision, discipline. Take control of your retirement. Do not leave it to chance. Do not leave it to Congress. Do not leave it to the market. Your financial security is your responsibility, and you are capable of achieving it if you commit to doing what is necessary. If you found this information valuable, please subscribe to the channel and hit the notification bell so you do not miss future videos. Share this video with someone you care about who needs to hear this. And leave a comment below telling me your biggest retirement concern. I read every comment, and your questions help me decide what topics to cover next. Take care of yourself, take care of your money, and I will see you in the next video.